record. And we will get going. So first of all, thank you and welcome for joining us today for our Telehealth Open Forum, which is dedicated for members and consumers, meaning individuals who have Oregon Health Plan, OHP, or have had and participated with the Oregon Health Plan. And to get us started, we just wanted to review a little bit of accessibility information, and I will let my colleague Rosie share this information.
Again, thank you so much for being here. And yes, we're gonna go ahead and get the accessibility information. So for interpretation in Spanish, you can go ahead and click on the globe that has the label interpretation on it and select the language and the interpreter. So on the first image that you'll see on the site, you'll see the globe, and you're going to select, if you have the option to selecting Natalie or Julene, you're going to select Natalie as she will be starting with the interpretation if you have to select an interpreter. And also we wanted to let you know that we are also providing closed captioning in a specific language. You just have to click on the live transcript and subtitle settings to be able to do that, which is shown on the second picture on the screen. We will be going through a lot of information. We'll be taking comments. You can unmute yourself and provide your comment feedback, but you can also do that on the chat. So you're more than welcome to, as we provide the presentation and go over the content for today's session. If you have any questions, any feedback, any comments, you can definitely put them on the chat, and we'll be able to, if we have the time, go over your question and answer your question as we go. And let's see. And right now, what we're gonna do is we're gonna start off with a little bit of introductions. We're gonna introduce ourselves.
Vamos a comenzar con las presentaciones.
And Natalie, I think I was able to hear you on my end.
Oh, can you send me to the interpretation channel?
Yeah, definitely.
Oh, okay, thank you.
Yeah,
And
no,
tell them
thank
about
you.
me.
And then Julene as well. Okay. All right. This should be all taken care of. I think I saw that you were able to do that before I did. So I think we're good to go. Again, we do have two interpreters, Natalie and Julene. And Natalie will be starting as an interpreter if you have to choose one of them. So, and again, we're going to do introductions. I know we have some folks that have joined, so I think we'll have a little bit of time to kind of go around and do introductions around who's in the room. So I will go ahead and pass this on to Diane and her team.
Thank you, and good evening. Well, I'm in the Pacific time zone, so it's 6:10. So I appreciate everyone being here and giving us part of your evening hours. My name is Diane Quiring, and I use she, her pronouns. I work with the Oregon Health Authority Medicaid section and have been involved along with many others around policies, development for telehealth services for the last 3 years. On the slide also, you'll see a picture of a coworker of mine, Janet Herb. She's not here tonight, but she also works on policies that are specifically connected to telehealth and how that works for CCO, coordinated care organizations, which are scattered across the state. And I will pass it over to Edgar.
Hi, good evening. My name is Edgar. I also work with Diane. I am the administrative specialist for our team, the quality assurance team. I recently started here last month, so and thank you for letting me be part of this discussion.
Thank you, Edgar and Diane. Thank you for those presentations. We're going to go ahead and move on to our presentation. So the CPOC presentation. So I'll go ahead and let Alma do her presentation first.
Hi, good evening, everyone. My name is Alma Ponce. I am the Regional Outreach Coordinator for the southeast part of the state. I serve Malheur, Grant, Baker, and Harney counties, some of the smallest and more rural parts of the state. And another cool thing about that is that I also get to live within the communities that I serve. I currently live in Malheur County, and I love this part of the state. And I will let my colleague Rosie introduce herself.
Hello again. So thank you, Alma. My name is Rosa Armenta. I'm also a Regional Outreach Coordinator for the Northeast region, covering Umatilla, Morrow, Wallowa, and Union counties. Again, the smaller areas, very rural areas. And I also do get to live in the communities that I serve. I'm located in Hermiston, Oregon, close to Pendleton. I think everybody knows Pendleton just because of Roundup every September. So, you know, if you haven't heard of Hermiston, the minute I say Pendleton, they're like, yes, I do know where you sort of live. It's like 30 minutes away from Hermiston. So thank you so much for again being here and engaging in this conversation that we're going to have about telehealth. And we're going to go over quite a bit of things, but I kind of want to see if it's okay if we can do introductions in the room, just because we don't have a lot of, we'll be able to get that taken care of. We don't have a lot of folks here, so it'll be a good opportunity for us to know who's in the room. And if you can maybe just say your name, you know, and what you're hoping to get out of this session, that would be great. I think I can go and choose Janet Orozco to go and do her presentation.
Hello, good afternoon. My name is Janet Orozco Ortiz, and I work for the Nehalem Bay Health Center and Pharmacy. And today I am excited to just learn more about what's going on and what is being proposed for telehealth services. So yeah, thank you so much for the opportunity to do this virtually. Thank you.
Thank you, Janet, for coming into this space and wanting to learn more. And I have Michelle.
Hi, yes, thank you. I am the survivor of a beloved dearest friend, Kathy, who I found through a welfare check on February 15, 2020, after she didn't return calls on February 14. And it seems I'm very concerned. We are very concerned that it was an uncounted COVID case. And she has surviving family who are on OHP, and I'm in touch with others in the community on OHP. So I'm here because I can't be, and to speak how telehealth has been so important to save their health and lives, and hope to appreciate your having me. Thanks.
Yeah, no, we appreciate your time and coming and sharing that feedback and experiences. So we really thank you for being here today, being able to share that with us. So thank you, Michelle. What we're going to be doing is some of the objectives that we're going to go over today. The review of background of telehealth. So we're going to be talking a little bit about the background of telehealth. Again, sharing those experiences for telehealth services. We want to know, like you said, Michelle, what's been working, right? Maybe what hasn't been working for the telehealth services. So getting that feedback through this forum. We're going to be doing review proposed rule change. We have one proposed rule change that we're going to go over in more detail about what that change entails for telehealth and OHP members. Again, collecting feedback from participants about the rule change. So we want to know your thoughts, your concerns with this specific rule change that we're going to be going over here shortly. Again, discussing language access. And then we're also going to be providing you ways to connect with us. So even after the session is over, we want to be able to provide you different avenues that you're able to, if you have any questions, if you would like to provide more information, more feedback, we'll be able to provide you many different ways that you can do that. So, and we'll be going over that here shortly, coming up in the next few slides. And as of right now, I think I'm going to go ahead and pass it on to Diane to kind of share with us the telehealth background and get to hear more from you. Thank you.
Thank you, Rosa, for that sort of overview of what we hope to accomplish. So also just want to express appreciation for being here in this virtual space and taking time. So I want to provide just sort of a background of what's happened around telehealth. And so what you see on the slide here is simply a document that kind of hits the highlights. Telehealth is not new. I think it wasn't used a lot before the COVID-19 pandemic. And so many providers across the state and the country had to quickly sort of move from in-person encounters, office visits with their patients and clients and community to virtual. And that was, of course, for a number of reasons, primarily to reduce potential exposure for people who may have COVID symptoms, as well as to make sure that those individuals who had potential symptoms of COVID could get treated quickly or referred to a place where they could, be tested or care provided. So it was both for the protection of patients and their family and community, as well as hospital staff and doctor's office staff and so forth. So it was a very sort of confusing time, I think, for everyone, because no one really had a lot of experience of how do we do this? What technology do we use? What is allowed in terms of privacy? And so because of that, across the country, there were a number of federal regulations that were eased that allowed certain platforms that could be used that weren't necessarily public platforms. So you couldn't just go onto Facebook and have a chat, but you could have very specific ways that you could interact with have interactions between a provider and a patient or client. So because of that those changes, we had to, at the state level, file what we call temporary sort of emergency rules that gave us the authority to, yes, allow it in more capacity and expand the list of and clarify for providers who could provide healthcare services via a telehealth, whether that was through a computer, iPad, or some mobile device, or your telephone if you didn't have access to other technology. So we did those temporary rules in March of 2020 that allowed us to do that. And then we took some time in the fall, late fall or in 2020 to get input from providers and the community about how is telehealth working, what questions they have, and then we updated our rules for 2021, and then we did that. We also updated them in 2022. So Oregon is not a lot different than other states around the country in that, there was a sharp increase in the use of telehealth to receive and deliver healthcare services. That sort of peaked, July-ish of 2020, and then has dropped off and somewhat sort of stabilized now. But we know it's going to be an important, just another way to receive care. So we know, we want to support continuing it in the future, but we also know sometimes there's some downside to telehealth, and we want to be sure that we're trying to maximize the good things about telehealth and minimizing the downside things. So it's important to Oregon Health Authority to make sure that members have a choice in how they receive services, whether that's in person or through telehealth. And so I think we can move to the next slide.
Alrighty, so I can kind of get us started with this. So we wanted to start the conversation related to any experiences, thoughts, or concerns you may have from these last couple years using telehealth or anything that you may have experienced. So I really just want to open it up to hear from all of you today. And feel free to take yourself off of unmute so we can hear. Or you can use a chat box, whatever works for you. Michelle and Janet, any experiences that you have been able to be a part of or heard of regarding telehealth and how it's worked?
Yeah, so I can bring up an experience that a patient shared with me. Well, it's kind of like a various patients too, but just similar situations. But there was a patient who needed to see a provider, and she was just she was immunocompromised, so she couldn't really, like, you can't really leave your house or go out. You have to like be very protective of yourself. And so that was something very positive for her and a very positive experience. And luckily I was able to walk her through and kind of help her set up like the step-by-step on to make sure that she got connected to her provider. And also from other patients, I've heard that they enjoy being able to get a doctor's appointment or like a specialist appointment from home. Especially since I live on the coast, so we're a very rural area and we don't have that many specialists. And so that was another plus for a client, was being able to reach those specialists and other providers from their comfort of their home. So yeah, that's what I have to share from that. So it's been a very positive experience. So I think it's really great.
All right. Thank you so much for sharing, Janet. Really appreciate it.
Excuse me, and am I audible?
We can hear you, Michelle.
Okay. So I'll follow up on everything that was just said. I agree with that, and I will add a few other things. In the community that my beloved friend was involved with, it included a lot of people with different disabilities, and she was very committed to doing what she could to ensure dignity of care and access. And some of the things that we appreciate about telehealth, and thank goodness OHA transitioned like that for the safeguarding of this community in the best interest. So different disabilities have really, as far as I know from the community and what I've observed and experienced too, different disabilities really benefit in different ways. And it's not just the fact that often providers and patients aren't going to be or haven't been compliant with masking to keep things safe in hospitals. And though even when there's been low infection in the community, obviously there's still a lot of infection happening in medical settings because people get sick and they go there for care. So, they're not monitoring it. And so so I've had friends talk about people getting infected in interactions, unfortunately, even with the masking order in place. And so they found it a lot safer with immunocompromise, and also other conditions like another friend had trouble getting wheelchair, parking with dealing with the wheelchair and spaces. And so it just made it much easier to access through telehealth, just that burden of driving. And then other people with diabetes, for instance, have to test blood sugar or monitor that for safety. So there are many ways in which telehealth has been useful beyond the safety issues around COVID. Excuse me. Excuse me. It's a really beautiful service. The use of it is incredible. It would be a shame if that goes away because there's a belief that only a minority are accessing it, but it ensures equal access. From their experience and from what I've observed too, it's just been fantastic. And I'm afraid that the majority wins. So like if people think that it's not of service enough that it'll go away, but it really is essential for the people who have been the hardest hit by the pandemic. Another example, my friend's relative who's on OHP has a developmental disability and cannot wear masks. So she relies on the safety of those masking around her. And with the lifting of the masking order, it will be very unsafe for her to access care. Her father is concerned, and who reasonably wouldn't be concerned, because we all have to protect each other, and she would be at high risk. I believe the developmentally disabled groups had much higher rates with COVID, and now I think there's not even ability to access vaccines more than once a year. So that means that they were concerned that that might leave them under vaccinated. So even exposed to COVID, they'll end up in peril potentially if the vaccine doesn't last in their bodies for the full year. So these are some of the concerns that have come up and that make the telehealth option truly relevant and really fantastic and life-saving, and just I think one of the best things about Oregon, according to the folks I've known and what they've talked about in terms of telehealth and what I've seen and experienced too. So I hope that's okay. All of this is okay to say.
Thank you, Michelle. And yes, we appreciate all of the feedback and you being able to share those experiences with us today. If there's no other experiences or thoughts or concerns regarding what has worked well these last couple of years, I would like to go ahead and jump into our first topic, which is the proposed change to the telehealth rules. So I just want to share briefly, the changes to the rules would require that when an OHP covered individual wants to have services provided in person, but the provider only offers services via telehealth, then the provider must refer the patient to another provider within 2 business days who does offer those in-person services. With that being the proposed change, we want to pose this question. Will this recommended change help members receive care in a way that meets their needs? I really want to have a conversation around that. Please feel free to share with us your thoughts. And let me know if something didn't quite make a lot of sense, and we can definitely clarify it and answer more questions related.
So first, if I may ask, I wonder if there'll be other sessions like this. I just found out about it randomly, and it would be awesome to have. It would be really great to have people more than just a couple of us give feedback on it. I don't know if I could pass this on to people who would have perspectives on it. Final opportunity to comment.
So this is just a space to share thoughts. We will have other opportunities to submit formal comments. We'll discuss those at the end of the session today. We really are trying to get as much consumer and member engagement and feedback for this as we possibly can. So thank you for bringing that up, Michelle. Our group is rather small today. It's always I'd say very difficult for us to reach communities, especially those individuals who are receiving the program benefits themselves. But we're really trying. So yes, we hope to have other spaces like this in the future.
Thank you. Well, I do have a comment about this based on difficulties finding providers. One issue, and I didn't want to speak over the other person. So if it's okay, I'll just finish this, but the other person's welcome to chime in or stop me if she has things to say here. So one of the concerns is that there are very few, in some cases, there are, there's been a lot of turnover with providers. They may not have room available. A lot of providers have retired. I don't know if others can speak to this, but it could be so I guess if the referral to the other provider happens within 2 business days, that doesn't necessarily mean they'll be seen in 2 business days. And the question is, there's a bandwidth issue with providers. COVID's hit them, and it's going to hit them more with, we're concerned it will hit them more with the beleaguered healthcare system and providers really burnt out or quitting or retiring and sick a lot. And so the question is, even with that referral, it presumes that there'll be people to refer to, and those who have an understanding of disability, which isn't always the case in specialty areas and all that. So the question is, it's a big burden to already put on the person offering telehealth to begin with. And it would be great to have that referral, that support, and it's necessary, but I'm just concerned about the practicality for people who are already stretched to the limit and lacking providers. And hopefully individual healthcare systems will keep things safe for their employees not to have illness because of preventable COVID, to help keep providers around, but who knows, so thanks.
Thank you, Michelle. Thank you for sharing that perspective. Anyone else have any other thoughts to add before we move on to our next topic? All right, if not, don't worry. Like I said, we'll have other ways to connect with us after. So let's jump into our next thing. We're going to be discussing access, and I will let Rosie take this one.
All right, thank you, Alma. And thank you for all the feedback and experiences that have been shared so far. I want to go ahead and talk about the access question. So existing rules and federal law requires that providers must accommodate language access needs such as interpreter services. Our question to you is, have you experienced difficulty with having an interpreter or interpretive services available when you have a medical appointment in person, or whether that appointment would be via telehealth? So we want to hear your experiences around language access when having in-person appointments or telehealth appointments. So please feel free to unmute again and let us know if you do want to share an experience.
So for this question about experiencing difficulty having an interpretive services available, so this hasn't personally happened to me, but it has happened to other patients and clients that I have worked with. And there was a time, and it has well, it's a reoccurring issue, I should say. And so, and this was made aware already to I think her name is Brenna. I can't remember what her last name is, but I did bring this up to Brenna a while back. And so what had happened was our clinic had referred a client over to a hospital to see an oncologist. And so this particular provider was would not see this patient unless this patient is a Spanish speaking patient. And so the provider would not see this patient unless she brought her own interpreter, which I said that's not right. They should offer interpretation services. And this provider, he's a known provider to do this to all Spanish speaking and other non-English speaking patients. And so that is something that a lot of patients, have struggled with. And I know that, like, personally, like I have also experienced that. And so I think it's just, it really, I guess, really depends on maybe like the area where I don't know. It's just, I mean, because on the coast, we really don't have that many Latinx like community. We do, but it's not like a big population. And so, yeah, that's what I wanted to share with that, was just the lack of interpretation services being offered to patients when they're referred to other specialists or other like hospitals, or because at our clinic we have interpretation services available, and so like right on hand, so which is so convenient for us. But yeah, I would just say it was just that one experience of the one provider that's known to do that. And then there's also a dentist who will do that as well. In the county, will do the same thing. The assistant will just flat out say, no, we can't see this patient because they don't speak English. And then another thing is that, they depend on the patient for them to find their own interpreter, which should not be that way. They should help as much as they can, so that way they can, because that's just putting like a delay in care with that. So yeah, that's what I have to share.
Thank you, Janet. I appreciate that feedback, that perspective that you're providing with the difficulty in accessing language access for appointments. And I just want to make sure that this is not a proposed rule change, but we wanted to ask this question and get more feedback. And again, your feedback was wonderful. So thank you for sharing, Janet. Does anybody else want to share any experiences with access language?
I just wanted to say I hope this could be brought to the deaf community. I know that in other settings they've often expressed exclusion, and I hope that infrastructure is there, but I just hope that this could be brought for their understanding as well. Thanks for ability to comment on.
Thank you for commenting, Michelle. And again, if you have any questions, any other feedback that you would want to share with us, you feel free to unmute or share on the chat. But would anybody else want to share an experience with language access?
This is Diane querying. I'll just sort of add, it's troubling to me to hear experiences where clients, OHP clients, are being refused care, specifically tied to language access, because that is against federal law. So that's concerning. And there would be ways to, I guess, elevate that. And that's kind of outside of this conversation, but I just want to express how troubling that is for me to hear. Not that I didn't know that that was happening, because I have heard those stories. We've heard similar stories when we had sessions in December of 2020. And we've also had sessions, like I pointed out, with providers, and so there's work to be done to educate providers and hold them accountable to meet state and federal regulations around this. So I just wanted to state that, and I appreciate that it's sometimes scary to bring those things up in a public meeting like this. So I just want I want you to know that we hear you. And the what was the other piece of my thought? I guess I think both of what's been shared thus far has been around a lot of positives in terms of telehealth in general. But I wondered if there has been any, if there's anything that you can share in terms of your experience with a telehealth appointment that involves interpretive support services also in the telehealth room. If you haven't, that's okay, but I'm just sort of curious how that has gone, good, bad, or otherwise.
Anyone on the call have any experience with telehealth services and accessing language at the same time? If not, don't worry. If you hear of any stories or know of any individuals who have had experience, whether if it was good or bad, using telehealth services along with language interpretive services, we will have some methods to receive some feedback. So please feel free to share with them. We want to try to get as much comment as we can regarding these topics that we're sharing today. If we don't have anything else to add to the access question, I do want to jump forward and share with you different ways that you can connect with us at OHA after today's forum. We know sometimes it cannot be clear on how to reach us, especially regarding rule changes similar to what we're sharing today around telehealth. So we wanted to provide some pathways and hopefully be able to continue these conversations and engage all of you in future conversations, whether if they're about telehealth or other opportunities that OHA has available. So first of all, for any feedback related to today's conversation that we're having, we do have an email that you can send any inquiries about. It will be community.outreach@odhsoha.oregon.gov. And this email is managed by individuals on the Community Partner Outreach Program, who you'll commonly hear referred to as CPOP. Another way to engage with OHA is you can sign up to receive notices about rulemaking activities, which includes the Rules Advisory Committee meetings and program updates. And I was going to ask Diane to share a little bit about what a Rules Advisory Committee is for all of you. This might be some new terminology, and you might hear the acronym RAC. Diane, are you able to share a little bit about what a Rules Advisory Committee is?
Sure. Yes, good point. Thank you, Alma. Um, so Oregon administrative rules are the way that we basically implement what is in state law. And so our Oregon administrative rules guide, how it is that if for the Oregon Health Plan, how we cover health services, how we pay providers for those health services, how providers bill the Oregon Health Plan or their coordinated care organization. So it's kind of those details. And before we can finalize rules, they have to go through what we call a rulemaking process. And so we engage with community partners. Those might be providers. They certainly, we want to include Oregon Health Plan members and providers and advocacy groups and a broad variety. Anyone who is going to be impacted by rules, we're really making an effort to engage with them as we're doing the rulemaking process, as we're writing new rules or we're changing rules, which we call amending the rules. And so there's a process, and part of that process is a rules advisory committee. And so that's what the link on the slide will take you to a place where you could sign up to see, to get updates via email or text messages about rulemaking. And you can specify like topic areas. So if it's behavioral health services, you want to learn about the rules around behavioral health services or, dental, oral health services. So it's kind of broken down into topic areas, or you can sign up for everything and you'll get lots of notices. So that's what that is.
All right. Thank you so much, Diane, for sharing a little bit more of what a Rules Advisory Committee is and its purpose. Another way that you can get information from OHA is by accessing that Rules Advisory Committee calendar, which is managed by the Oregon Health Authority Health Systems Division. Also, a public comment period is open usually sometime after there's been proposed rulemaking changes for the telehealth rules that we were discussing today and anything else regarding telehealth. There is an anticipated public comment period that's set to be open in April this year. And also notices of proposed rulemaking will be published each month in the Oregon Bulletin, which will include a link for you to access. If you're interested in submitting a written public comment regarding the telehealth rules that are proposed, I would definitely recommend visiting the website and getting familiar with it so you receive the information on how and when to submit that public comment. A lot of it can be related to what we talked about today, or you can do a little bit more research to get familiar with a lot of the information around telehealth. If you have any specific questions, feel free to reach out to us as well. The public comments are submitted during that public comment period by emailing a certain inbox. It is the hsd.rules@oha.oregon.gov, which we have listed. We do plan on sending a copy of all the material that we shared today, this PowerPoint, to you I would say within the next week, along with the recording of the session and the information. This is going to be public for you to view and share with other individuals who you feel might be interested in learning more about how to connect with us and what we discussed today. And with that being said, I want to check in, see if there's any additional questions, any outstanding questions or concerns that may have come up with everything that we reviewed and discussed today.
May I ask one follow-up about the comment about the telehealth providers referring to in-person care?
Yes, go right ahead, Michelle.
Thank you. I guess I just wanted to make sure I understood. Did that mean referring within 2 days of just having a contact, or that they would be expected to have care, to find a provider who could provide care within 2 days? I wasn't reading that carefully.
Thank you for that question, Michelle. So the way it is written, or what we're considering writing, is just that the referral would be made within 2 business days, so that the provider would find a provider, the provider that only offers telehealth services would identify a provider who offers in-person services and make that referral within 2 days. So it doesn't, as you pointed out, have anything, any stipulation around, well, then after that referral is made, how quickly would the client be seen by that in-person provider? We're well aware of the many sort of limitations in the providers in different parts of the state, different specialties, et cetera. So it's a challenge.
Oh, thank you for that clarity. Then it sounds like it makes sense to coordinate care or refer. So I thank you for considering my other concerns, but yeah, I'm glad that the clients wouldn't be falling through the cracks if they couldn't get the care they needed. So thank you.
All right, thank you so much for that, Michelle and Diane. Any other outstanding questions? If we don't have any more outstanding questions, I want to just say thank you for those of you who were able to join us today. And we really appreciate it. Please share your experience with us afterwards. You're more than welcome to send us an email, process what we discussed today. We do hope to have other opportunities similar to this where we can engage with community members directly. We know this is fairly new, and hence probably why we had such a slim participation today, but we were really excited to have those who were able to join us and share with us experiences that they've either lived or had the opportunity to see or hear from others in the communities that they live in. So thank you so much. And like I mentioned, we will have this material available. I will be emailing it, I'd say within the next week, along with the slide deck and the recording for you to reference. And with that, I will let you all go. I know it's time for dinner. If you have kiddos, you probably need to go and tend to them as well. So have a great rest of your evening, and we hope to continue to offer these opportunities in the future. Thank you.
Thank you so much.